Hello, everyone. Welcome back to Inner Ear Secrets. I'm Aardra.
I'm Sara.
And I'm Sabrina.
And today we're here to take you through a general audiology appointment. So, gal, sometimes when I tell people I'm studying audiology, they seem to mistake it for audio engineering or some type of audio technician. So it shows that there isn't much knowledge around who we are and what we do. So, Sabrina, before we started the degree, what did you know about a typical audiology appointment?
I basically knew nothing until, as I mentioned in our first episode, I accompanied my grandma to an audiologist appointment. So I got to see what a general diagnostic testing setting is like. And then they talked to her about hearing aids as well. So I knew that audiologist was to do with hearing devices as well. So I think I was quite lucky in that sense that I actually got to see what audiologists are like. But Sarah, did you know anything about how audiologists work before you started this course?
No, I had no clue. And I think the thing that surprised me the most was how long the appointments are. The appointments go for about an hour, 45 minutes, which is way longer than a GP appointments. I didn't think it'd be 1 hour. And if you do balance testing, it's 2 hours. And the amount of tests we actually do in an appointment surprised me. I just wasn't expecting that. I was just like, oh yeah, I'm going for a hearing test. It's going to be 10 minutes, 15 minutes max. And then it's an hour.
That is a fair point, actually. I knew nothing. I'd never seen an audiologist before, never been to one, but I was so set on becoming an audiologist. When we were learning about the appointment itself, I think I've mentioned this before in a previous episode, I wasn't surprised that we were learning it, but it wasn't what I was expecting. It was just, this is what's happening. I went, okay.
Yeah, that makes sense.
I'll believe you.
Yeah. You kind of know what's going on, but you don't know exactly the specific steps. You know you're going in for a hearing test. What that entails is completely different from what you would expect.
Sarah, in that case, can you give us a rundown on the typical structure of an audiology appointment for adults?
Yes, I can. First, we take your history. So we'll just ask you a couple of medical questions and ask you about how your hearing is. And then after that, we follow by the testing. So we do the testing where we give you a button and we do a little click when you hear the beeps. And then we have a look in your ears. We check your hearing. We check the health of the ear, including how well the eardrum is moving and the space behind it. And then we give you, the patient, some feedback based on what the results are showing us. So that's just a quick rundown. We may throw in other tests depending on clinical judgment if the results aren't what we're expecting, things like that. And we'll give you our professional recommendation. Overall, that's just a really simple version of how an appointment runs. We'll be going into more depth.
Absolutely. So, guys, let's get into a little more detail. Sabrina, what can you tell us about history taking?
Yeah, so history taking is definitely one of the most important part of an audiology general appointment, where we get to find out about what brings you into the clinic, what factors may be contributing to your current presentation with your hearing loss or disorder. It also let us get to know someone and gauge how to best interact with them for the entirety of the appointment. So we would ask you things based around your history with the ear, nose, and throat specialist, if you've ever seen one, and your general health as well. So any cold in the past 3 months or any flu symptoms, as well as family history and how well your balance is. And if there's any ringing in your ears or buzzing in your ears, so asking about tinnitus and any history with noise exposure as well. So, have you been exposed to loud sounds recreationally or for work?
And is there a reason that you ask about balance? Because, all the things you mentioned kind of made sense, but I guess it doesn't really fit everything else that's being asked.
Definitely. People sometimes don't associate balance being related to the ears, but there's actually a balance organ in our ears that help with keeping us steady and making sure that we don't feel dizzy. So it's located very close to the cochlea, where the balance organ forms a key part of the inner ear. and it sits right alongside the hearing organ, which is the cochlea, the technical term. And sometimes with some pathologies, our balance can be affected even if something has happened to our hearing. So, this is why audiologists can become vestibular or even balance clinicians as a specialization to go into.
That's so interesting. In that case, when you're asking these history questions, how open should you be with your audiologist?
Definitely be as open as you can. We want as much information from you, and if you're comfortable with providing us with more, that's always what we want to hear. And it also helps us with moving along the appointment as well.
Yeah. I think it's important to note as well that sometimes some of the questions that we ask can sound pretty personal. And, with some people, they're very open to us and they tell us everything. We don't even have to ask half the
Mm,
questions. But then, we'll ask questions about their partners, like, can your partners hear you? Um, do you live with other people? Things like that. So, yeah, just letting everyone know it actually can get quite personal. And the more open you are,
mm,
like Sabrina said, the better.
mm. Yeah, and
Yeah.
we asked the question for a reason. We're not trying to probe into your private life. So it is because we want to gauge a broader understanding of what's causing the issues.
Yeah.
Yeah, absolutely.
I actually have a question about the noise exposure part. And I think a lot of people will be quite interested in that part. So I've been in it to a concert or two. So, they're really loud, really crazy speakers left and right. So at what point would a noise exposure ring alarm bells to you?
So I think noise exposure becomes a concern when it's prolonged or extremely loud. So we typically worry when someone has had regular exposure to loud environments without hearing protection. So, for example, if you work in construction or you have been attending many loud concerts consistently, or been using noisy equipment as well and not wearing the earmuffs or any hearing protection, the damage can accumulate over time, like a dosage effect, and that can lead to a noise induced hearing loss. So, it's if you're frequently exposed to loud noises like the situations that I just described, it's important to use hearing protection. And it's quite easy to do as well. Just need to get some earbuds and put that into your ears. That's all you need to do.
Yeah. Thanks for I think that is definitely quite eye opening in terms of understanding the risk of noise exposure. And I think a lot of the time people don't realize that sometimes it can just take one event to really kickstart that permanent type of hearing loss. So yeah, I think it is important that we are open and honest and taking precautions with our hearing as well.
Mm.
Alrighty, so let's move on to the testing part of the appointment. So, Sarah, what kind of tests can someone expect during their visit to the audiologist?
All right. So after taking history, we usually do otoscopy. And that's where we use a torch and we shine the light in your ear and we check for any abnormalities or any blockages that shouldn't be there. And then we do a hearing test, which we call pure tone audiometry. And that's where you press a button every time you hear a beep. So this involves listening to sounds at various pitches, so from low pitch to high pitch and different volumes through the headphones.
Yeah, with the headphones, we can test how well sound is traveling into the ear. So when we play the sound goes into the ear and it hits the eardrum, which in technical terms we call that the tympanic membrane. The sound then travels through the tiny bones in the ears called the ossicles, which are made up of the malleus, incus, and stapes. They're also commonly known as hammer, anvil, and stirrup. And then that goes into the cochlea or the hearing organ. But we can also check directly as to how the hearing levels are at the cochlea with a small device that's called the bone conductor. And that is placed just behind, underneath our ear on our bone. And that stimulates the sound through directly to the hearing organ, the cochlea.
Hmm. Yeah, so in a sense, you're bypassing how sound would usually travel through the eardrum and the ossicles and seeing how the sound is being picked up by the hearing organ itself and seeing if there's a difference between the hearing. So that's how we can differentiate and categorize different types of hearing losses. So some people might have a blockage of sound, between the outside of the ear and the tiny bones, or they might have some damage to the sensitive cells that pick up sound in the hearing organ itself. So you could have one or the other, or you could even have both types of hearing loss at the same time. And what we do is, as you're doing the test, we actually graph it on something called an audiogram. And that's, if you get the results back from your audiologist, that's the big graph that you see. And so you've got volume on one side and you've got the pitches on the other. So that's how we are able to tell you as to what's happening there at the level of the outside of the ears as well as at the hearing organ itself.
That sounds really interesting. So we know so many tests that we would need to do and need to be aware of what's going on as well. What happens if someone can't do the testing this way? How can we get results then?
Yeah, so we do have what we call automatic and objective tests. So that reliably figures out where someone's hearing level is without them having to do the little button test. Yeah, so the hearing test itself is a behavioral test. We rely on someone responding to sounds to figure out where their hearing level is and what is the softest sound they can hear. Automatic testing, on the other hand, uses qualities of the hearing organ and parts past that include the neural pathways up to the brain to rule out certain levels of hearing loss. So this involves us perhaps just putting a plug in the ear and playing some sounds and seeing how the ear responds. They're called autoacoustic emissions. This is probably what we'd be able to do if an issue was to arise. Yeah.
It's good to know that your audiologist has options to pick up your hearing levels. Aardra, what comes next?
Yeah, so after we've checked your hearing level with the beeps, we like to see how you perform with words. So this is where we run speech testing. So this is where an audiologist presents lists of words through the headphones for you to repeat back to them. There are calculations that we run based on your hearing test to determine how loud we need to present each of these words. And typically we'll do 2 runs on each ear. So one loud one, and then we'll do one soft one where we actually don't expect you to get everything correct.
I guess what's the purpose of speech testing? Because, pure tone, we've already done that. We know the hearing levels. Why are we doing speech on top of that?
Yeah, it's a great question. So speech testing shows you how your hearing would operate in the real world with speech sounds, and it'll show you if you'd benefit with a hearing aid or not. So that's why we test at those loud levels, because at those loud levels, you should comfortably be able to hear and perhaps get everything correct in the speech testing.
Yeah.
Mm.
And after the speech test, then that's the more relaxing part for the patient. You don't have to do anything now at this stage. We will run some automatic tests where we'll just ask you to sit still while we do them. We'll be putting a little plug in the ear that blows a puff of air into the ear, and that's just for us to see how the eardrum is moving.
Yeah, and with that, we can see if the eardrum's moving too much or it's not moving enough, which might help to explain the type of hearing loss if there is a hearing loss.
Yeah. And after this, we might keep that plug in and test how well your hearing responds to loud sounds. So, what we're trying to do here is elicit a reflex that we all naturally have to sudden loud noises. Have you guys ever been surprised by a loud noise when you weren't expecting it? And did you ever feel like your ear suddenly shut off in terms of the sound that was coming in?
I wouldn't say like for sudden situations.
That's really interesting. I feel like I've experienced this a lot.
Yeah,
Oh,
same. I have
really?
definitely
Yeah?
experienced.
Yeah.
Mm.
Yeah, I think I've definitely felt this reflex happen.
Mm.
It's like a loud sound will happen, and immediately I feel, because when this reflex takes place, it actually, even if it's sound is surprising you or it's sudden from one side,
Mm.
it's a reflex that happens on both sides of the ear.
Mm.
So I've felt my ears just kind of shut in a sense, and like I felt it quite physically.
Mm.
But yeah, like that's why I've asked if you felt that before, because I've definitely
I
felt it. And
definitely
like
have. Or even like bark from a dog or something like that.
from a dog, yeah,
Yeah.
exactly. And you just suddenly go like this, and like you feel your whole like head kind of get like,
Yeah.
Oh, that's
I don't know how to explain
interesting,
it.
guys. Like I've
You've
never
never experienced this.
like I've definitely had times where, I've had really loud sounds. I just don't really remember like these specific instances. But it's so interesting that you're saying that you remember like the feeling? Because I don't remember
Yeah, I
the
can remember the I feel it quite physically. Like,
Same.
so that's why when we were learning about this, I knew exactly what this was talking about because I was like, I experienced this a lot. So what we like to see is that this protective mechanism is kicking in. What this is essentially there's a tiny muscle that contracts to dampen the amount of sound that gets through to the ear, to the cochlea, to then try and reduce the amount of potential damage that occurs when these loud sounds happen. So sometimes when we can't see this happening on the test that we perform, it can point to problems with the hearing itself or other issues in perhaps the nerve.
I actually
Mm.
I found out by doing this test on myself that I can physically contract this muscle in my ear. So on the test, I can have like a lower threshold or lower level than
Oh,
what it
what?
actually is. Yeah.
Oh, so you
You
can
know
do it
what?
by
I think I want to give that a go now
Mm,
because I think I can.
right?
Maybe this is why I experience it on such a physical
Yeah,
level.
same, same. I didn't know. It didn't click to me until we learned about this and then we did the 10 ourselves. Yeah.
God, I have to give this a go then in clinic.
Okay, no, I can't do it. I'm trying it now. I can't do it.
Mm.
Yeah, no.
Mm.
All right. So after the test, we'll normally go through the results with the patient. So we explain what the tests show and discuss any hearing losses or any other issues that we found during the testing. So then we provide professional recommendations, which might include hearing aids, referrals, other specialists, or just monitoring the situation. So it's all about ensuring that the patient understands their results, their hearing health, and what steps to take next.
Yeah, thanks, Sarah. That really demystifies the process. Sabrina, do you have anything that you'd like to add to that?
Yeah, one more thing that I wanted to say is it's important for patients to ask questions if they don't understand anything. We're audiologists, we're here to help and want to make sure everyone leaves the appointment feeling informed and supported. So if there's any questions, make sure shoot them at us. We're open to any questions.
Yeah, absolutely. Well, that's all we have time for today. So thanks to everyone for tuning in to Inner Ear Secrets. We hope that you found this episode helpful and insightful.
And remember that your hearing health is really important. So don't hesitate to reach out to any professional if you have any concerns about your hearing.
Thank you to our listeners for tuning in to Inner Ear Secrets. Next time, we'll be talking to a very special guest about cochlear implants. So make sure you tune in then. Don't forget to subscribe to the podcast and make sure you follow us on Instagram and TikTok at Inner Ear Secrets Pod. You can also find us on YouTube as well. Until next time, take care of your hearing and keep listening.